Again, xiphoid to pubic symphysis to make sure that there's an isometric contraction. How does the blood pressure cuff work? Let's explain this. And everyone who is taking this course needs to understand how to explain this to their athletes as well. So if you have an athlete laying on a table, if they are arching their back and lifting up their legs, they are flexing their hips and overusing their hip flexors, a lordosis will result in their spine. As soon as they use their rectus abdominis too much, a kyphosis of lumbar or reversal of lumbar lordosis will go. If you don't use your hip flexors too much, right, to give you into an arch, and you don't lift your head up and use your rectus abdominis, it results in a neutral pelvically tilted position as well as rib tilted position, and you simply place the blood pressure cuff underneath the athlete in order for them to get to a base level of neutral, which they can maintain a 40 mmHg, if you will, and you pump up the blood pressure cuff while underneath the athlete so that it is neutral. Then, and only then, while you ask them to do activities, they should be able to contract it and raise that pressure down, which then raises the dial on the feedback to a 60, only 40 to 60, not 40 to 100. We're not doing Valsalvas. We cannot drop below 40 because we don't, if our hip flexors are lowering, we can't do it anymore. Our hip flexors take over. And if our abs aren't winning by at least 1%, it results in an arch. Let's go through that again. I'm laying on my back and I'm jackknifing and I'm lowering my legs and I'm at 60 and I'm contracted at 60, I'm at 60 and all of a sudden I'm at 40. You have gone too far. Quality over quantity. I guarantee you, for those of you who are on this that are medical professionals, if you walked into a gymnastics gym and told somebody that they should never have their kids do a 2-minute hollow hold, they will look at you like you're crazy, because the culture of gymnastics is the more you do, the better you get. The problem is, if it's not the quality and the exact muscles that you're training, you are training something in pattern to respond to verbal stimulation, to respond to tactile stimulation, to respond to actual flipping, and to have as coordinated muscle movement patterns in the exact wrong way.